Human Services Secretary Xavier Becerra spoke exclusively with CBS News about kids' vaccines, as well as the state of the COVID pandemic. Joining me now with more on that conversation is CBS News correspondent Enrique Acevedo. Hey, Enrique, you and I are both parents of young children. You and I have also discussed this issue. So tell me, what have you learned?
We talked to Secretary Becerra today about vaccinations for children under 5 years old. As you know, Lana, both Pfizer and Moderna have applied for emergency authorization. Well, they're in the process of doing that and providing the data required by the FDA for this emergency approval. We asked Secretary Becerra about this specifically, and he told us that they're waiting to gather all the data before going ahead with the approval process. This is more of what he told us this morning. This week, Dr. Anthony Fauci told PBS that the country is out of the pandemic phase, to be precise. He later expanded on that view. He said that the pandemic is not over in the U.S. and we could still see new infections as the virus continues to mutate. So the question is, are we or are we not out of the pandemic here in the U.S.?
Well, as Dr. Fauci said, we're in a far better place than we were a year or two ago, and it's good, and we got to keep that going. But the pandemic is still here. Several hundred people a day are dying. A couple of 2,000 to 3,000 people are still being hospitalized every day, and so we know that COVID is still with us, but we're in a far better place, and we urge every American to do everything we've learned that helps, so we can get in an even better place. So get that boost, or certainly get the vaccine if you haven't been vaccinated, but get the boost. Make sure that you continue to be careful with your children. We hope soon, at some point, to be able to vaccinate those under 5. But be very careful with your grandparents, someone who may have a underlying condition, and certainly your children.
You mentioned vaccines for children under 5 years old. 2 companies have already started research in the case of Moderna and Pfizer. Do you have any updates on when those could be approved and the status of those approval processes?
Once they have submitted all the data that we require at FDA to be able to move forward, I know that FDA is really hungry to be able to move as quickly as possible. So once we get the plate filled with all the data, they'll be able to move quickly.
A Washington Post analysis of state and federal data found that vaccinated people made up 42% of all the COVID-19 deaths during January and February of this year. These were mostly people over 65 years old that were not boosted, but it's a striking increase compared to what we have seen in the past. Why is this happening?
So I think those data are saying a couple of things, and I would want to make sure I'm looking at it closely to really make sure we can make some readout on it. But one, it still shows that the folks most likely to die in this country today from COVID are the unvaccinated. But two, it points out something very important, that getting vaccinated today doesn't mean you're protected forever. We realize that we have to continue to be alert, and that's why the boosters have become so important. So if, as you've mentioned, if the data are showing that older Americans who were not boosted are the ones that might be dying, even if they were originally vaccinated, please understand the message there. Stay vaccinated, get boosted, be safe.
So, Enrique, Secretary Becerra also touched on healthcare disparities in the U.S., primarily based on race. What did he say about the department's work to address the issue?
Well, Latinos and blacks are dying even today at almost double the rate than whites, mainly due to 4 factors. They are overrepresented in the population that we have deemed essential during the pandemic. They have poor access to quality health care, pre-existing conditions, and lower vaccination rates. Those are the 4 fronts that Secretary Becerra told us he's been working on with a team at HHS to make sure that these inequities, the normal that blacks and Latinos knew before the pandemic and suffered during the pandemic, is not the new normal after we are done with the disease and with the virus here in the U.S.
All right, Enrique, thank you.
Thank you, Lana.